Madam President, I want to talk a little bit about the letters I've received and the messages we've received in the office the last week regarding the changes we see going on in health care. Quite a bit of discussion last week about how health care impacts the workplace, and I think a lot of misinformation out. This report doesn't say, as some people have alleged, the CBO projection, the Congressional Budget Office projection, doesn't say that 2 million more people are going to have part-time jobs. It says the equivalent job loss because of the Affordable Health Care Act is the equivalent of 2.3 million people losing full-time jobs. That may mean 10 million people that otherwise would have had full-time jobs have part-time jobs. The other thing is it's 3 times as big as the number that was on the table when people voted for the Affordable Care Act. Well, at that time, the Congressional Budget Office says if this law passes, that there'll be 800,000 fewer jobs than if this law doesn't pass. The collective impact on the economy is 800,000 fewer jobs. Well, last week they said there'd be 2.3 million fewer jobs, roughly three times the amount that the earlier estimate was. And like so many other estimates in this law, the reality of the law turns out to be different than the estimates, and surely that was an estimate that nobody wanted. I can't imagine that anybody that voted for this bill, and I didn't vote for it, but I can't imagine that anybody that voted for this bill thought that's a really great thing. We're going to lose 800,000 jobs if this bill passes. I assume they thought the good this bill will do will offset losing 800,000 jobs. Now we find out it's 2.3 million jobs and all kinds of information that the good that was supposedly going to be done is not what people had hoped for. While we're talking about the workplace, I've got a letter here from a person who's the president of one of our community colleges in the state of Missouri, and he says, because of the Affordable Care Act, we've reviewed all part-time employment to ensure compliance with the Affordable Care Act, which defines full-time as 30 hours or more per week. Without specific guidance in knowing the difference in a credit hour and a working clock hour, we've reduced part-time faculty teaching loads to ensure that nobody works more than 30 hours. And this isn't the only letter or contact that all of us have had on this topic. We know that the unintended consequence of this law on the workplace was that people are now told who they don't have to insure. State governments, community colleges, big companies, all looking at a law for the first time that supposedly says who you have to insure, though the president certainly feels he has the authority that none of us can find anywhere in the law to decide when the law is going to go into effect and when it's not. But the law says who you have to insure, and suddenly people who for a long time have provided health care benefits because they thought it was the right thing to do or the competitive thing to do, now respond to this directive from the federal government that says what you have to do, and that means that's all you have to do. So all of these employees who may have worked 25 hours, 28 hours, 32 hours in the past and all got insurance, now are suddenly working less than 30 hours. And I've talked to enough of these employees to know that this isn't because they don't want to work more. This isn't because they want to make less money. This isn't because they want to teach one less class. It's because the law has had that kind of impact on the workplace. The other letters, the other promises, we're going to get better coverage for less cost. Surely somebody is getting better coverage for less cost, but my guess is that is a much smaller group than the people that are losing their insurance. And because of the so-called broader and better coverage, the so-called better coverage have more costs. Here's a letter from Kathy in Wentzville, Missouri. She says, I carry insurance through a large corporation, and my premium increased this year because the minimum standards in the law affect my plan. The premium increased by 25%. She goes on in no uncertain terms to suggest that she doesn't like the Affordable Care Act or think it was affordable. Jeff from St. Joseph said, "Thank you for the opportunity to share my family's opinion on Obamacare. First off, I'd like to state that we've experienced increases in our health insurance. My employer's insurance has doubled, of which I pay 1/2. My family's separate insurance policy has risen as well, with cancellation due in December. I've considered canceling my own health insurance through my employer so I can provide for my family's health insurance at their new rates." This was a family that a few months ago thought they were going to be able to continue to keep what they had. They liked what they had. They thought they could afford what they had. Now they're deciding who's going to go without insurance so other people can have insurance in the family at the higher rate. William from St. Louis, Missouri says, "My insurance was canceled in December. Says, my insurance rates have been drastically increasing each year since the law was passed. 4 years ago, I had a policy for my family with a $500 deductible and the ability to go to any hospital or doctor in St. Louis. It cost $1,000 a month. Now I have a policy with, he says, with a $2,000 deductible, and I can't go to the doctor I used to go to." And he says his policy now that doesn't allow him to go to the doctor he used to go to doesn't cost $1,000 a month any longer. It costs $1,500 a month. Ted in St. Joseph said that his doctor has changed the way he does business. Says he's downsized the types of plans he accepts and is moving to a customer base with higher incomes. So Ted's doctor, according to Ted in St. Joseph, has stopped taking patients with Blue Cross Blue Shield because of increased cost, and now Ted, who, by the way, liked the doctor he had, now has to find another doctor that will take the coverage that he can get. Steve in St. Joseph and his wife are raising their 14-year-old grandson, and all three have seen their insurance cost, they think, because of the Affordable Care Act. His grandson's policy went up $50 a month, from $104 to $154. His wife's deductible went from $1,000 per year to $5,000 per year, and her insurance cost over $800 a month. Now, he goes on to say, and I thought about whether I should read this or not. I assume they've talked about this too, but he says, if we were to get divorced, her premium would be less than $200 a month. I think Steve is not suggesting that he and his wife should get divorced, but just talking about, again, the unintended consequences here. A family that's together can't afford to have the coverage they had. Her coverage is $800 a month, but as a substitute teacher, I believe that's what this letter says she does, her income would qualify her for a $200 a month policy instead of the $800 they're paying now. Sandy from Armstrong, Missouri, says she received a letter from her insurance company notifying her that her premiums were about to increase. She went on healthcare.gov to find plans she and her husband could qualify for, and the plans she found were double the premiums she'd been paying. Kelly, Farmington, Missouri, works at the HR department, the Human Resources Department at a bank. She feels that healthy groups will be paying more for insurance because of ACA and because of the expanded coverage. Her department's received many questions, she says, about health care coverage that feels limited in how much they can really tell anybody because they don't know how the new law is going to apply. The law of unintended consequences continues to be the law that applies here. Missourians and people all over the country are contacting us and asking how much damage we're willing to do to the healthcare system that was working to get more people included in that system. There were ways to do this every one of which I believe was legislatively proposed in 2009. Small changes that would have made a big difference in a healthcare system that was working for people who were in that system. We need to figure out the few ways to get more people in that system. Instead, we've had dramatic impact on the best healthcare system in the world, and people are beginning to figure that out.